Hello everyone, my name is ABM Rizaul Islam. I'm a Bangladeshi citizen. I went back, I'm an engineer in profession. After reaching there, within few months, I developed like chronic diarrhea and bloating and gas in my stomach. So after 6 to 8 months later, I saw that I was having some pimples coming in very often in my rectal area, and then suddenly one of them turned into fistula. It was very painful experience for me, and then I met a doctor over there and he suggested me to do a surgery. He was a general surgeon and he did the surgery, and then unfortunately it didn't work well for me, and then he referred me to another doctor who was a colorectal surgeon. So under him it went very good, and then I was completely healed at that time. 1 year later, what happened, I was feeling very nauseatic for few months, and then one day I like kind of vomited and then couldn't eat anything else. So that time I went to the hospital, and then they say after doing multiple tests, CT angiography, and then a few weeks later a colonoscopy, they determined that I have Crohn's disease. Crohn's disease journey began from that time. The doctor I met over there, he started me with a medicine called vedolizumab. After taking it for a year, it was not working well for me, and then I was having severe pain in my rectal area. So then what happened, they wanted me to switch to another medication. It was adalimumab, which is called Humira. So after taking it for several months as well, it didn't work good for me, and then meanwhile I developed one more abscess in my rectal area, and they did a surgical incision to drain it out. Meanwhile, I decided to come back to my own country, Bangladesh, and in March 2023, I returned. In April 2023, I returned to my country, Bangladesh, and I saw Dr. Alapathi's videos online and also Dr. Raghu's videos online, and I contacted with Dr. Raghu's office and then came here for treatment under Dr. Alapathi and Dr. Raghu. So Dr. Kishore Alapathi, he did my abscess drainage surgery with set-on placement, and it was a successful surgery, and alhamdulillah I am doing very good after that. And then they also started me with a infliximab infusion, and I've been taking it for the 1.5 years since then. So I am doing very well right now with the treatment that Dr. Alapathi and Dr. Raghu provided, and I'm very thankful for them. I'm very grateful for them. Whoever is watching this video, if you have any fistula or anal colorectal related problems, please meet Dr. Alapathy, and whoever has any GI issues, please meet Dr. Raghu. They're really smart people, and then they're very confident doctors. I really like them. Thank you so much for watching, and thanks to Hyderabad Apollo Hospital.
Hi everyone, this is Dr. Kishore Alapati. I'm consultant colorectal surgeon from Apollo Hospital, Jubilee Hills. As you've heard from Rizal, he's had a very tough journey since his diagnosis of Crohn's disease. As he initially presented to us about a year and a half back or so, he was in a miserable situation with very bad perianal abscess and poorly controlled Crohn's disease. So the reason why we wanted to present this is basically Crohn's disease is something that almost always requires a team approach. It would require a qualified medical gastroenterologist and also a qualified colorectal surgeon, because Crohn's disease always poses a significant combination of issues that would require a team approach. So a fair number of times patients would have infections like perianal abscesses or interabdominal abscesses, or a narrowing of the small intestine or a large intestine. Typically we call stricture of the intestines. So when we come across these scenarios, it has to be a team approach. Whenever there is an abscess or an infection or a narrowing, surgically we go ahead and correct these problems, and then after that we follow it up with medical treatment. So his was a very success story because it was a nice team approach that was offered from Apollo Hospital, Jubilee Hills in Hyderabad. As I went ahead and took care of his infection in the anal area, and also to prevent any future formation of abscesses, we went ahead and planned for a seton placement at the same time, so that even at the time of seton placement or after the seton placement, you never had any abscesses, right? Because the seton would help in continued drainage. And so because the abscess or the infection was cleared off of his body completely, Dr. Raghu was able to treat him with really strong medications to control the inflammation from the Crohn's disease, which is what we call the Remicade injections. He did very well with that. After that, he came for a follow-up where the Crohn's inflammation has pretty much minimized. And so I went ahead and removed the Ceton right in my OPD. He did not require a second surgery or anything like that. And even after the Ceton was removed, you completed the Remicade.
Yes.
And then as of now, there are no issues with anal abscesses or fistulas or anything like that. Most recently, he had a repeat colonoscopy done, which showed a very minimal inflammation in the rectum and healing ulcer in the small intestine. So again, an emphasis on anybody who is diagnosed with inflammatory bowel disease, which is either Crohn's disease or ulcerative colitis. We want you to see or approach a facility which has the backup of both medical gastroenterologist and a qualified colorectal surgeon who will be able to.
Important.
Yeah,
this is very important.
Very important to have a team approach to. As you've heard, it is qualified team. Everything we would plan, 6 months or 1 year ahead and do it today, so that when a patient completes his treatment, his recovery would also be equally smooth in the interventions that we do to them on a daily basis. Thank you.
Hi, I'm Dr. Raghu, gastroenterologist at Apollo Hospitals, Jubilee Hills. Today we want to talk a little bit about our patient, Mr. Razaul, a long-standing patient of ours from Bangladesh, who has been suffering with inflammatory bowel disease for the past few years. He has received multiple treatment modalities in the past, including biologic agents, anti-inflammatory medications, immunomodulator medications, off and on use of steroids in between for flares. But he has had recurrent flares of this inflammatory bowel disease. He also had severe perianal disease, for which he received Ceton placement by our colorectal team, at which time he was referred to us after reviewing his complete history and doing a thorough examination of the gastrointestinal tract. We decided to change his treatment modality. We started the patient on biologic agents, a new biological agent other than the ones that he had previously used. We started him on infliximab at 5 milligrams per kg body weight, following which he has had dramatic response to the medication. Eventually his Ceton which was placed was removed. His perianal disease also improved. We just had another repeat colonoscopy on him at a follow-up today. His symptoms have significantly improved other than occasional dyspeptic symptoms. The colonoscopy shows that his perianal disease has significantly improved, just mild inflammation in the terminal ileum, for which we will probably start him on a short course of budesonide steroids for a short duration of time. So that's where his symptoms stand, and it has been a good response to these biologic agents in this patient.